Here's something that I learned through the paramedic program is how to take a good set of vitals. With every patient, I'm gonna have to take their vitals to see if they're present and how they're doing and what state they're in. So I'll walk you through it, and I'll show you how to do it. Okay, so I walk in. I have my proper protective equipment, which is gloves, steel toes. Let's just pretend I have them. If the patient is vomiting or something like that, I have an N95 mask, a shield, whatever it takes. Okay, so, and I'm checking for hazards, anything that can hurt me. I don't see anything. So as I walk in, I present myself always. So, hi, my name's Eric. I'm a student paramedic. Can I help you?
Yes.
Okay, so I noticed that my patient is alert. She looked at me spontaneously as I walked in. I'm just gonna ask you a couple questions. You don't mind?
No.
Okay, so do you know where you are?
Yeah.
Okay, where are we?
My house.
Okay, and what's your name?
Nick.
And how old are you, Nick?
21.
Okay, and do you know what day of the week it is?
Wednesday.
Okay, so, and I'm Eric, by the way, nice to meet you. So she shook my hand, so her motor skills are intact. She answered all the questions, so she's alert. So the GCS, the Glass-Coleman scale, would be 15. So that's good. Okay, so I'm just going to check your pulse. At first you say, I'm going to check your pulse, but you're actually checking the respiration. You wouldn't tell your patient that, because they can control their respirations, but they can't control their pulse. So you just look at their chest rise, and you count how many chest rises in 1 minute. So I pretend to take the pulse, check, take your radial pulse, and I look at my watch. Okay, so 15 breaths per minute, regular and full, and the pulse would be 68 beats per minute, regular and strong. And I was looking at her stomach rise and fall, and that's how I checked the respirations. Okay, so next we're going to do the blood pressure. So is there any reason I can't take your blood pressure? Any mastectomies, fistulas, lymph removals? You ever take your blood pressure before?
Yeah.
Okay, can you hold this for me? And can you grab my hip here? Let me know if you're uncomfortable or anything, okay? Here, you pump it right up, and then you let it drop. So it's 110/70, is that normal?
Not sure.
Alright, it's pretty normal. Okay, so I'm just going to check your pupils. By checking the pupils, it'll let me know if your cranial nerves are damaged or anything like that, any trauma to the brain. So, could you just look at my left ear? And do you have any dizziness right now? Seeing any double vision? Anything like that? Okay. So I'm just going to shine the light in your eye here. Just look at my right ear. And her pupils constrict at the same time so that everything's alright. Her cranial nerves are intact. And then can you just look at the top of my pen here? So she followed everything. So her cranial nerves 3, 4, and 6 are intact. And that means she has no trauma to the brain. I'm feeling her skin. You don't mind if I touch you?
No.
You always ask for consent. Her skin's pink, warm, and dry. I don't notice any medical arts bracelets, any patches or anything like that. And as I was doing it, she didn't have any body odors. So, and I checked for edema. So edema is swelling of the lower extremities. You push it, and then if it stays, it's called pitting edema. Usually in the elderly and cardiac patients and so forth. And You'd reassess the vitals every 5 to 10 minutes to see if there's any changes, if you change them positions on the stretcher and everything. Thanks.